Don't know if you want to do some kind of introduction here. Hi guys, so today I'm injecting drugs into my body. I will make a clip explaining. Right now I'm just struggling to get the vial open. Here we go. So first thing we do is we rub, make it very sterile. Then I'm going to use the second one on my hands just to make sure that they're really sterile. I could / should be using gloves, but like, oh well. She said I didn't have to. Okay. I'm going to clean off the site, and I have to do it in between the bruises. Arlo, go away. You are not sterile. I mean, you're probably as sterile as they come, but... This is my favorite part because it pulls off all the gunk on your skin. These aren't very thick pads. Clean off injection site. Now what are you doing? I am opening the needle. And I'm putting it on. It's a screw-on needle. It's got a fancy name. I don't remember.
It's a lot easier than... Oh man.
What?
Well, my doctor sent me a video of how to do port infusions.
Wait, this one stays on? Okay. This isn't the needle they showed me with.
And I got to watch this video, and they have like a sterile field, and you do it down like that?
Yep. All the way to the one. Except there's air, so I'm gonna push it back. And then I'm gonna just move it slightly. I'm gonna pull it out. And then you grab it with your hand and you go flap, 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 flap.
What does that do?
It gets the bubbles out.
Mm-hmm.
How do you know?
How do I know? Because I just told you she made me watch a video.
Before your appointment?
Yeah.
And then I have to move my leg around because it hurts like a son of a bitch.
Wow, you're like not even bleeding.
I might have put it in the same spot by accident. It's okay. I did it a week ago. And then I'm gonna feel better enough to train, which is gonna be great. And then the vial's basically empty. It's a one-stop shop here. It's a single serve vial. So I'm just gonna rub, and then I'm gonna set this in there because I'm gonna take it up to my sharps container. But I sat for like 5 minutes waiting for the nurse, and I was like, can I rub? I just rub it in, and I move my leg. It's muscular, so your muscle's like, fuck you. And I say, no, I'm good. Ooh. So just try to give it a nice massage, get that medicine working in there. And then I'm gonna take all my trash and I'm gonna put this stuff in the trash. And that's kind of it. And I'm gonna put these guys in the sharp container and these guys in the trash. And that's it. And I'll talk to you guys about why I'm doing this in a little bit. Hi guys, so I've got my water. I just did about like 5 minutes ago, I just did my Ketorolac injection, so I'm gonna talk to you guys about why, and basically how it works. So basically I had to sit down with my migraine doctor. My migraine doctor had told me over the phone that if I got a migraine, he wanted me to go to the emergency room every time because he wanted me to get the migraine cocktail. I said, that's not a great idea because I can't afford to go to the emergency room every time. So he had said, oh, well, find somewhere near you that does it. And I was like, oh, okay. And I couldn't find anywhere. And I asked him if there's anybody that could help me. He said, no. I said, well, I don't know what to do. And he's like, the nurse was like, oh, well, we could try giving you Toradol at home, which is part of the migraine cocktail. Usually it's Toradol, Zofran, and then Benadryl. But I'm just taking the Toradol right now. I might go upstairs and get a Zofran. So basically, to help me with my migraines at home, I have Toradol that I can use 10 times a month. So it's kind of like two and a half migraines per week. Yes, Toby, I feel that. Now, we have to be a little careful because first of all, it's an injection. It's not in pill form. So that's not great, but like, it's not good because it can introduce like bacteria and things like that. But at the same time, it's the quickest way to get it in my body and for it to start working. And also I can't overuse it because it is bad on your kidneys. So it's a couple things to watch out for. I have to get some routine blood work done. But basically this is our ideas in trying to treat my migraines since the Emgality is starting to slow down on its effectiveness, and the other emergency medication I'm on, Nurtec, has also slowed down in its effectiveness, which sucks, but you know, can't make modern medicine work the way you want it to. So you just gotta keep trying. We're also doing magnesium infusions, which, if you didn't know, that's what she gets. Say hello, she.
That's one of the things I get. I get other medications when I do infusions as well, and pretty soon I'll have to do it myself.
Basically, I had said, well, my friend does this, and I wonder if it would be helpful for me. I don't have that type of, normally magnesium infusions are reserved for people that have something called hemiplegic migraines. So that's not the exact type. I did have some hemiplegic migraine like symptoms maybe a year or two ago, but they've since died down, which is good. But my doctor said that, I just brought it up. I said, hey, my friend does this and it really seems to help her. What do you think? And he thought it was a good idea. So that's what we're gonna do.
They're doing a different, so she's doing like a trial period where basically she does a couple migraines and or a couple infusions in like a couple days.
Yeah, so it is 2 migraines, 4 hours apart for 3 days.
2 infusions, you said 2 infusions. It's 2 infusions for how long?
Two infusions, 4 hours apart for 3 days.
What I get is I get them every month, and theoretically, if I basically originally when she prescribed them, she wanted me to get them every week, and then we were going to increase to twice a week.
But with school, there's no...
With school, work, and me driving, I just can't make that work.
Right, and especially because there's no good health care near school.
Right. School is, you're kind of fucked for health care there.
Because the school goes, oh, sucks to be you. Bye. You have chronic illness. See ya. So yeah, we are gonna just try that and see how it goes. So I'm probably like 10 minutes into taking the Toradol, and I don't know if you can tell by my talking speed, but I'm feeling better, which is great. I love it. Now it's really weird because with the Toradol, I don't feel the pain in my head or behind my eyes anymore. I feel it in where the muscles are, which I have myofascial pain, which is a fancy word for your muscles are tight as fuck. Except mine just don't like to loosen very well without help. So, yay. But we're working on it. We're working on it. But I'm starting to feel a little better. I did take it right before it got worse. I waited a little bit. I tried to do some other non-invasive type of treatment. So I have a meditation I do when I have time to lay down and like take a nap, or like lay down and set a timer just for a little bit. I try to do a meditation in my bed, which has like visuals to help you like breathe it out, and usually taking a nap also helps, but I wasn't able to do that today.
I said, oh, you're going there.
That is the current plan for my migraines. I'm still taking the Emgality, in case you were curious. No one ever watched those videos, but I'm still taking it, and that's still intermuscular in my stomach, so that's fun. And then I'm taking Nurtec, on the days I'm not going to take Toradol. Yeah, if you guys have any questions, leave them down below. Thank you guys so much for watching. Leave questions below about the migraine treatment, and yeah, we'll see you later.
Yeah.